Okay, so these are Medicare Part B covered preventative services. That's the entire list. Let's go over and I will explain which preventative services are covered by Medicare. Medicare covers many preventative services to help you stay healthy. You can talk to your healthcare provider about which of these services are right for you. Okay. Under Original Medicare, you'll pay nothing for most preventative services if you get the services from a doctor or other provider who accepts assignment. Assignment is an agreement by your doctor, provider, or supplier to be paid directly by Medicare to accept the Medicare-approved amount as full payment for covered services and not bill you for any more than the Medicare deductible and coinsurance. You'll pay nothing for certain preventative services. However, if your doctor or other healthcare provider performs additional tests or services during the same visit that aren't covered under the preventative benefits, you may have to pay a copayment and the Part B deductible may apply. Later, we'll discuss which preventative services require a copayment. Okay, so let's move on. Medicare Part A and Part B doesn't cover everything. If you need certain services that Medicare doesn't cover, you'll have to pay out of pocket unless you have other insurance to cover the costs. Even if Medicare covers a service or item, you generally have to pay deductible, coinsurance, and copayments. Items and services that Medicare doesn't cover include, but are not limited to, long-term care, routine dental care, dentures, cosmetic surgery, acupuncture, hearing aids, and exams for fitting hearing aids. Long-term care includes medical and non-medical care for people who have a chronic illness or disability. Non-medical care includes non-skilled personal care assistance, such as help with everyday activities like dressing, bathing, and using the bathroom. Long-term care can be provided at home, in the community, in assisted living, or in a nursing home. Okay. In addition to premiums, there are other costs you pay in Original Medicare. This is what you pay in 2017 for Part B, covered medically necessary services. The annual Part B deductible is $183 in 2017. If you have Original Medicare, you pay the Part B deductible, which is the amount the person must pay for health care each calendar year before Medicare begins to pay. This amount can change every year in January. This means that you must pay the first $183 of your Medicare-approved medical bills in 2017 before Part B starts to pay for your care. Coinsurance for Part B services in general is 20% for most covered services for providers accepting assignment. Some preventative services have no coinsurance and the Part B deductible doesn't apply as long as the provider accepts assignment. You pay 20% for outpatient mental health services, visits to a doctor or other healthcare provider to diagnose your condition or monitor or change your prescriptions, or outpatient treatment of your condition, like counseling or psychotherapy for providers accepting assignment. If you can't afford to pay these costs, there are programs that may help. These programs are discussed later in this presentation. You pay a premium for Part B each month. The standard B premium amount in 2017 is $134 or higher depending on your income. However, most people who get Social Security benefits will pay less than this amount. This is because the Part B premium increased more than the cost of living increase for 2017 Social Security benefits. If you pay your Part B premium through your monthly Social Security benefit, you'll pay less, about $109 on average. Social Security will tell you the exact amount you pay for Part B. Just want to make sure that you make a note. This premium may be higher if you don't choose Part B when you first become eligible. The cost of Part B may go up 10% for each 12-month period that you could have had Part B but did not take it. An exception would be if you can enroll in Part B during special enrollment period. because you or your spouse or family member, if you're disabled, is still employed and you're covered by a group health plan through that employment. Those who pay the standard premium, which is $134 or higher, in 2017 include people in one of these 5 groups. You enroll in Part B for the first time in 2017. You don't get Social Security benefits. You are directly billed for your Part B premiums, or you have Medicare and Medicaid, and Medicaid pays your premiums. So basically, your state will pay the standard premium amount of $134, which is Medi-Cal in California. Your modified adjusted gross income as reported on your IRS tax return from 2 years ago is above a certain amount. If so, you'll pay the standard premium amount and an income-related monthly adjustment amount, or IRMAA, which is an extra charge added to your premium, and we'll go over that later in the presentation. Since 2007, people with Medicare with higher incomes that have paid higher Medicare Part B monthly premiums. These income-related monthly premium rates affect roughly 5% of people with Medicare. The total Medicare Part B premiums for people with higher income for 2017 are showed in this table. So basically, for those whose income is $85,000 or less, and file an individual tax return, file a joint tax return with an early income of $170,000 or less, or file married with separate returns, the Part B premium is $134 a month. So basically, that's the idea. If you have to pay a higher amount for your Part B premium and you disagree, for example, if your income goes down, you can call Social Security number and see why that happened. The Part B premium is deducted from monthly Social Security, railroad retirement, or federal retirement benefit payments. If you don't get a retirement payment or your payment isn't enough to cover the premiums, you'll get a bill from Medicare for your Part B premium. The bill can be paid by credit card, check, or money order. For information about Medicare Part B premiums, you can call Social Security, the Railroad Retirement Board, or the Office of Personnel Management for Retired Federal Employees. If you can't afford to pay this cost, there are programs that may help you. These programs are discussed later in this presentation. If you don't take Part B when you're first eligible, you may have to wait to sign up during the annual general enrollment period that runs from January 1st through March 31st of each year. Your coverage will be effective July 1st of that year. If you don't take Part B when you're first eligible, you'll have to pay a premium penalty of 10%. For each full 12-month period, you could have had Part B, but didn't sign up for it except in special situations. In most cases, you'll have to pay this penalty for as long as you have Part B. Having coverage through an employer, including federal or state employment, but not military service or union, while your spouse or family member, if you're disabled, is still working, can affect your Part B enrollment rights. If you're covered through active employment, again, yours or your spouse, you have special enrollment period. This means you can join Part B anytime that you or your spouse or family member, if you're disabled, is working and covered by a group health plan through the employer or union based on that work, or during the 8-month period that begins the month after the employment ends or the group health plan coverage ends, whichever happens first. Usually you don't pay a late enrollment penalty if you sign up during a special enrollment period. This special enrollment period doesn't apply to people with end-stage renal disease. You should contact your employer or union benefits administrator to find out how your insurance works with Medicare and if it would be to your advantage to delay Part B enrollment. Okay, so let's move on. This is an example of how you might calculate a late enrollment penalty for Part B. So Mary's initial enrollment period ended September 30, 2009. She waited to sign up for Part B until the general enrollment period in March 2012. So total time Mary delayed Part B is 30 months. Mary's late enrollment penalty is 20%. Basically, 30 months includes 2 full 12-month period. The penalty is added to the Part B monthly premium. So Mary will have the penalty for as long as she has Part B. Okay. When you must have Part B. Basically, if you want to buy a Medicare supplement insurance or Medigap policy, you want to join a Medicare Advantage plan, you're eligible for TRICARE for life, or civilian health and medical program of the Department of Veteran Affairs. Your employer coverage requires you or your spouse, family member, to have it when you become eligible for Medicare, less than 20 employees. So talk to employers or union benefits administrator for more information. I just want to make sure that you understand Veteran Affairs, so VA benefits are separate from Medicare.